We've had in 23 counties mask mandates previous to this, covering about 90% of the population of the state of Utah. But we did think that there was a little confusion out there as far as who was in and who was out. And so because of the crisis that we're facing here right now today, we decided to make that mask mandate just statewide. But mostly because of the overcrowding of our hospitals. They are really at the brink of not being able to take any more people and the overflow mode, particularly in our intensive care units. And it's not that we don't have rooms with 4 walls, we just don't have rooms that have got doctors and nurses that can provide the health care in those rooms. We find that our highest infection rates are now coming from when we get together, not in structured events where people are in fact are following protocol of masks and social distancing, etc. It's coming from these casual gatherings where we get together with family and friends, and probably our guard goes down, we're a little more complacent. We don't follow those kinds of protocols and take the precautions that are necessary. But we're going to accelerate the testing program today to in fact include our college students. They should be tested once a week. Our professors and teachers and faculty in college also. We certainly want to test students that are involved in extracurricular activities in high school. We'd like to make sure that the teachers get tested at least once a week. This is less about government mandates and us telling you what to do. It's more about taking personal responsibility. But both of those working together, we believe, will help us to change and modify our behavior so that we have a better outcome. That's really the motivation here. We want to slow the infection, and we want to make sure that our health care is being taken care of. At the same time, making sure our economy continues to function.
You know, I really believe that if every Utahn adheres to the principles that were outlined by Governor Herbert, we will start to see a decrease in our cases, and we need that urgently. So it's up to all of us as individuals to really adhere to those principles to make sure that our healthcare systems can maintain the capacity to treat patients for both COVID and non-COVID issues.